Thank you to our fearless leader, Julie DeMarco. We got successfully into our Human Services Commission meeting, and I thank everybody for coming. And if we could just do a quick roll call, Laura Inserto.
Loretta Lorenzo.
Brenda
Mary
Steele.
Ellen Gavin.
Nee Tran.
Excellent. Thank you, everyone. Nice to hear your voice, Nee. So before we get started on our agenda, if we could just please say the Pledge of Allegiance. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Excellent. Thank you. All right.
Hi, this is Barbara. I just jumped on.
Oh, hey. Welcome, Barbara. Glad
Thank you. I was hoping to get there in person, but the day ran away, so.
Well, yeah, and so just a quick aside note, I wasn't sure if we were going to be able to meet in person, and Julie and I said, well, what should we do? I said, well, let's try to meet in person. And then when I touched base with her, she said that actually it was Linda and I who had responded in person. So I said, well, maybe we'll just skip this month and try to reconvene next month. But
so nobody's in person.
Well, Carolyn is there. Carolyn Derby.
Oh, Carolyn, great.
Yeah, Carolyn and Sheila with us.
And Sheila. Hi, Sheila.
Hi.
Great. So I think if everybody could make an effort for next month, let's all try to show up together because it would be great to be in person, I think.
Yeah. Yes.
Great. Okay, so moving on to old business. I'm hoping everyone had an opportunity to just look over the July minutes. And if we could get a motion to accept.
So moved. Carolyn moved.
Okay.
I second.
Second.
Barbara.
Any discussion? Okay. Everyone in favor?
Aye.
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 Thank you very much. Okay, Carolyn, what is your report for us this month from the Board of Health?
Well, it's sort of like last month. It hasn't changed a heck of a lot. But apparently things are leveling out. And Dan said this morning that the third dose, the Pfizer dose, is halfway accepted, and now the CDC has to accept it, and then it'll be ready for people 65 or over. But so far, it's just the Pfizer one.
And did they say how long it would take for that acceptance, Carolyn, by any chance?
A day plus. He said he didn't really know. He said it could be today, it could be next week. We have no idea.
I already got mine. This is Barbara, I went to CVS, my doctor gave me a note, and I got the booster. So, and my husband's getting his on Monday. So they are giving them, if people feel, they need to get them, they are available. Even before.
That's great. And this is Laura. Julie, does the Senior Center have any plans for distributing these when they are approved?
We're actually waiting to hear from the health department when those vaccine boosters are available, and we don't have a date yet. They originally had hoped September, but when I saw him today at a meeting, he said they don't know yet. And Pfizer, we didn't distribute a lot of Pfizer vaccines, so probably not this month. Definitely not September. We're maybe hopeful for October, but don't know.
So if it gets approved by the FDC, then would our Senior Center distribute them when it is ready?
I don't know. That's up to the health department. We just make the space available.
Okay. Okay, great. So you'll keep us posted on that?
Definitely.
Excellent. Thank you. Anything else, Carolyn?
Not really, but pertaining to but he said that the teachers and the students are not transitioning to each other with this virus. Apparently, whoever gets it is getting it independently of anybody else, at least in the school system itself. And that's what he told me this morning. It's not transitioning from within. That was his terminology. So I didn't ask how many people have it, but that's how he put it.
Yeah, wow, that's something. Brenda, are you there still?
Yep, I'm here.
Do you get the notifications from school about how many students or teachers are affected by COVID right now?
I do. They don't separate it. Yeah, they don't separate it by, students and teachers, but the numbers have been very low. Maybe one student at this school, maybe another at another school. So very low.
Good.
That is great.
Thanks.
Want to keep those kids safe.
That's really it. That's all I have.
That's it from Carolyn.
Thank you, Carolyn. All right, Julie, I think you said someone from the Friends was going to come on the phone and give us an update. I didn't hear if anyone did, but...
No, it turns out because we're still on the phone, it's not public comment. So they did give me a report, which was that they just wanted to let you know that they're still busy and doing things out there. They helped us with our emergency bags and are helping us with some programming going forward, like a holiday raffle and hopefully Veterans Day. And the Friends are doing an open house, like a coffee outside with the members to try to see if there's anybody interested in being on their board or just working with them on committees to do activities and planning.
Okay. What is the Veterans Day plan? Are you going to tell us that in your report?
I'll leave that for Brenda when we get to those department updates.
Okay, perfect. Thank you.
Thanks.
All right. Well, please tell the Friends we thank them so very much and encouraged by their participation for sure.
Great.
All right. So new business. We're going to have Julie report on the Connecticut Healthy Aging data report, which I think you all received by email, a lot of information to absorb.
Tons of information. So I'm not going to read through the whole thing, but I would love to just tell you about it. It came from Tufts University in a partnership with a few other organizations in Massachusetts. Has been doing this for Massachusetts for years, and they did it for Rhode Island last year, and they expanded it to Connecticut this year. And when you have a chance to go through it, it's a lot of really useful information. Much of it's from the census, in terms of the breakdown of the population and age and percentage of seniors and who owns a home and what the median income is. So, I don't want to read through it, but in terms of our planning, when you look at the medical conditions for Fairfield or the health concerns for Fairfield, we're in great shape. There's a lot of things that compared to other towns or areas in Connecticut, we have lower rates of, obesity, substance abuse, depression, and then a few areas that we're not doing as great with: breast cancer, osteoporosis, prostate cancer. And as you look through, you can see more of those. But it is interesting to see when you go on that report, you can compare us to other towns in our area, and we are similar to other towns in our area with those either the better or worse things. So, it's interesting for planning for the state for different programs about whether regionally there are issues that need to be addressed or if that's just, an anomaly.
So, Julie, this is Barbara. Was there anything, you being closer, to all of it, anything that surprised you or anything that really stood out that you said, wow, that's an area we haven't thought about? I mean, were there any takeaways, or it's too soon, to have processed the whole thing?
Well, that's a great question, Barbara. As you look through the health issues, the areas that we're doing well in and the areas that we're doing worse in, that will help us in terms of planning for, programs for the senior center. We have a lot of opportunities with our senior care providers to do lunch and learns and educational things. And these are areas that we can now focus on. If we know that we're not doing as well in areas I don't know what benign prostatic hyperplasia is. I'm sure that Mary Ellen could probably inform us. But there's there's 9 areas that we are not doing great in, and we could focus on those for our programming. And we should still focus on the other areas, just to make sure those numbers stay low.
Right. And one that jumped out at me was the hearing impairment. I thought was interesting, and I don't know what we have for like accommodations, in those areas.
Right. Well, that's definitely something we can work on. We have talked a lot with the Friends about perhaps updating some of our programming rooms to have that upgraded system that has a wire around the room. And I know I'm not saying it articulately, but it's a system that people who have hearing aids can tune in with their iPhone or smartphone and connect to the wires or speakers in the room. We haven't pursued that yet, but I think it definitely it's time to start looking at that.
Right.
The other thing that struck me was there's one of these slides talks about how there's one support group in town. That's definitely an area. So, it says we have 11 hospice agencies, 36 home care agencies. I think that's low, actually. Nursing homes, 3, senior center, caregiver support group 1. And
that seemed odd to me because I myself know more than one caregiver support, so I'm not sure, how that gets measured.
Yeah, well, and that was what was interesting was that when they sent out surveys and made phone calls and did all of this research, and that's all they came up with. So, we have to do a better job of educating our community about what's available. That's what comes off of that page for me. So, I would say when you have time, please look through it and see what else piques your interest. Like, just as Barbara with the hearing, that there's a lot more hearing loss than we expected. And I'm sure that it's not a surprise, and especially right now because COVID, with everything having been shut down, people are isolated and quiet. So, I'm sure that's a larger issue now.
Right, and when you wear the mask, it's harder to hear people. It's weird, but, it's muffled, and you don't look at the lips as much, so I think it's been an issue.
Yeah, I agree with you. So, I guess those are the highlights for me. I think I would love to have a further conversation, maybe when we're all in person, to just see if there's anything else that you thought of after checking it out, because there's, it's an election season. If I were, an elected official, these are certainly things I'd be looking at. Budget season, in terms of planning for, rapid response or emergency response. That's something that, the number of seniors and the number of people who are struggling or maybe not as ambulatory as they were. These are great stats to have for that kind of planning.
Now, Julie, did we ever get a report like this before, or where did this all of a sudden come from? Because it's pretty amazing, I think,
Yeah, it's new for Connecticut. They've done these in Massachusetts and in Rhode Island. More Massachusetts, and they've expanded it to Rhode Island and Connecticut, and I'm sure they want to expand it even further.
Yeah, this is Mary Ellen. They're really doing a lot of work right now with health equity in all the different towns, and a lot of the healthcare systems are looking at this tough study to identify where the weaknesses are town by town. So the big hospital systems are looking at this, as is the Department of Public Health.
It's great.
Yeah, it's an amazing tool. It really is. It's an amazing tool.
Well, one of the things that we mentioned in our minutes of last meeting, this is Laura, is that our staff met with Tony Huang regarding holding a state delegation event at the center. This could be a good talking point for that meeting.
Exactly. That's exactly right. That would be great.
Maybe we could, talk about how we can do that at our next meeting next month. Or has anything been set up with regards to having him hold a delegation event yet?
Well, yes and no. We had tried to schedule one. It was challenging to get because we need to have the entire delegation. We can't have one and not the others. So what we tried to do was get something for September, and it was just really tricky to get everybody on the calendar. So we're going to wait until after the election and try for November. None of them
Right.
are running, but it's just, just in terms of,
Right.
they will be, I'm sure helping other candidates.
Well, we won't be meeting till we'll be meeting in October, so that's good. So we could talk. Oh no, this is October. We'll be meeting in November. So if that meeting.
No, this is September. Oh no.
Oh, that's
this
right.
is September.
I'm sorry, yes. So we'll talk about it in October. Great. I'm getting all confused. Sorry, y'all. Okay. Good. So we'll put it on our agenda for October. That's perfect. And actually, speaking of, the speakers that we've obviously wanted to have join us, one of them, of course, is our first select woman, Brenda Kupchik, which, we haven't been successful in making that happen, but she's so busy. But I also wanted to mention to all of you, if you have not heard, she lost her mother this week. So if you wanted to drop her a note, or I didn't know, Julie, is it appropriate? Should the commission maybe do something for her? Maybe plant a tree? I mean, have we ever done that for a selectman's parental loss?
I think it's a nice, if you wanted to, write a note, that would be nice. And I don't know, I'm not sure that it would, I would say a note would probably be enough.
Okay. So like from the commission, or everybody write it on their own? What do you suggest?
I don't know. What do you all think?
Some people don't know her.
Yeah.
Or what?
I mean, I think it would be nice from the commission then, since people
Right.
personally don't know her.
Right.
Yeah, Sheila had a great idea. Maybe, Laura, you could write something from the commission.
Yes, I'm happy to do that.
Perfect. Oh, that'd be great. Thanks.
Okay, you got it.
Thank you.
All right then. Anything else on Connecticut Healthy Aging? Or
No,
can we
but
move
please
on?
take a minute to look through it, because there's a lot of great information in there that's it's not just about seniors. It will impact our work with veterans and our work with people with disabilities. There's a lot to that report that gives us great information for planning.
Good.
It is an amazing tool. It really
Yeah.
is. It's the data. So.
Thank you for bringing that to our attention, Julie.
Sure.
All right, and how about we move you right into your department update?
Okay, so we're, Brenda's on, so I'll let Brenda jump with the senior center side. On the social services and transportation side, we're busy. It's energy assistance season. The moratoriums on evictions and shutoffs are up, so we are seeing an uptick in calls and referrals, and also in referrals from police and fire as people are emerging from being shut down. So we're busy. We're good, but we're busy. And holiday season is coming up, so we'll be again doing our holiday program for families. I think that's about it for social services. Transportation's fine. We're still limiting our bus to 4 people a ride, so that's we're making more trips to different activities, but we're really only limited to 4 people. So Brenda, on to you for the senior center side of it.
Okay, thanks. Hi, everyone.
Hey,
things
Brenda.
are going well. October calendar is packed full with a lot of fun and additional activities and programs, which we're excited about. We still, of course, have the mask mandate, so members have to wear the masks inside, even during exercise classes and pickleball. And overall, they've really been doing a great job. We've seen attendance drop down a little bit in those classes, but for the most part, people are still coming in. We will host flu shots at some point, but similar to the boosters, we just wait to hear from the health department on those dates, and they haven't been established yet. But we'll certainly let everyone know when. We will help the health department, with the flu shots. And other than that, everything's going well. We still are serving just lunch once a week, drive through and out on our patio. Fortunately, we've had some nice days, so we'll look to serve outside as late as we can.
Absolutely. I thought about that today. I thought, wouldn't it have been nice if we all could have met outside there? But it was calling for rain.
I know.
Pretty gloomy out.
Well, thank
yeah.
you, Brenda. Really appreciate
you're
that great
welcome.
report. Yeah. Any
Okay.
other business?
Any questions?
Nothing.
Okay.
Talk about a succinct meeting. So give us an update just as to what's going on with the Disabilities Commission. Anybody have one?
Julie, you want to take that, or should I?
Sure. Well, if you can start, and I'll chime in if you miss anything.
Okay, sounds good. This is Loretta. We have 3 applications for people who have submitted applications to be on the Disabilities Commission, and we're still looking for more people to get involved and to submit their applications. We have a press release that is in the works to go out to help promote it and hopefully let people know that this is happening in town and that we're looking for motivated people to step up and help out and get involved. It's exciting that we are here and looking to take it to the next level. And I'm guessing, though Julie may give more information about the selectmen, if they are waiting for more applicants before they start to review them, which is what seems to be the case. Anything else?
Does that mean that once they review them, then the commission will be in full swing? What is the process?
Once we have commissioners. So.
And how many do you need to make a commission? Is there a minimum?
There are 7 commissioners. So I've had some email exchanges with some of the people who have submitted their applications. But yeah, we need 7 commissioners to be complete. I do not know if we can proceed with fewer.
Mm-hmm.
Julie, anything else you want to share?
No, but I am hopeful that the new press release will garner some interest, and we can include that to, the public schools and to SEPTA and to other different organizations to try to get the word out. So I'm hopeful. It's a little slower than we had hoped. We had hoped that once it was appointed, we would be at this point, changing the world. But we can wait until we are. We're good.
Julie, you just said something very interesting, which is in terms of the public schools. We have not done any, at least I have not done any outreach to the schools and getting into the flashes that the school districts send out. That is an option. What do you think about modifying that press release and submitting it to be included in all the districts, in all the each individual school?
Yeah, I think that's a great idea. Let's talk offline about that, see how to go about doing that.
Okay, great.
Okay.
Awesome. Thanks for that report, Loretta. Anything else? Other business? Well, then I guess we can call for a motion to end our meeting.
It's Linda. I'll make a motion to end the meeting.
Loretta,
do we have a second? All in favor?
Aye.
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 Excellent. Thank you, everyone. We will look forward then to seeing you all October, let me get that number for you. That would be October 28th.
Perfect. All right.
Okay.
Thanks, everybody.
We're all going to try to be in person, right?
Okay.
That would be wonderful.
Yeah.
Good.
Bye, everyone.
Enjoy the fall weather, and we'll see you all October 28th.
Thank you.
Thank you.
Thank you. Bye.